understand the problem of polycystic ovaries, we need to know what happens during a normal menstrual cycle. So here I have shown the uterus. Everybody has one uterus, and the mouth of the uterus known as the cervix, two tubes and two ovaries. So the egg is released from the ovary, and the problem, as the name suggests, polycystic ovaries, the problem is with the ovaries. Then what happens normally is every month about 4 to 5 eggs. This is the small egg. Okay, so every month around 4 to 5 eggs they start developing. Out of these 4 to 5, only one egg becomes bigger and bigger, and finally on the day of ovulation it ruptures, and the follicle ruptures and the egg get released. So this is the normal, that is 4 to 5 eggs getting starting to develop, and out of which only one will mature and the egg gets released. Whereas this is a polycystic ovary, where instead of 4 or 5 eggs, there is simultaneously more than 7, 8 or even 10 eggs will develop. As a result, none of them will become bigger. They all, the development actually stops at some time, and none of the eggs or none of the follicles will get bigger. As a result, all these follicles get arrested and they accumulate on the surface of the ovary. So your doctor might have told you that there are many cysts on your ovary. A cyst is nothing but fluid filled small balloon like structure. It will be very small, maybe around even less than 10 millimeters. So all the eggs get accumulated here instead of rupturing like this in the normal cycle. So then it follows, if one egg is released normally, then the cycle goes on normally, and therefore the person also gets their periods normally. So when we give the treatment, when we say we are going to give ovulation induction, it doesn't mean that we are getting in new eggs. It's only that we are pushing all these eggs to develop. In a normal person, the cycle is like this. The estrogen is a hormone that is normally produced by the ovaries, and it is acting on the endometrium of the uterus. Now, when the egg is normally released 14 days before the next menstrual cycle. So the release of the egg is released and it is caught by the tubes. This is called the finger-like structures are there, and the fimbriae, and the egg is caught in the tubes. The empty structure, which is known as the corpus luteum, begins secreting the progesterone. The progesterone hormone again acts on the endometrium of the uterus, and sort of it prepares it for a possible implantation of the fertilized egg. That is, once the egg gets released, the whole uterus sort of anticipates that this egg might get fertilized and it might get implanted and continue as pregnancy. Therefore, in anticipation of that, the progesterone is secreted by the corpus luteum. However, if there is no fertilization of this egg, then the corpus luteum gradually dies. And once the corpus luteum dies, the hormone progesterone gets reduced, simultaneously estrogen also, and this causes the shedding of the endometrium, which goes away as menstrual flow. So the withdrawal of these two hormones will cause the menstruation. So it follows that anybody having a regular ovulation might also be having a regular menstruation. Whereas in case of polycystic ovaries, as I have explained, no egg is released and therefore there is no progesterone. Once there is no progesterone, only the estrogen is acting on this, and because there is no progesterone, there is no withdrawal of the hormone, and therefore the person may not get their periods for long periods of time, or as long as the estrogen levels are able to maintain the integrity of the endometrium, it stays there. When once there is an impairment, again the person may start bleeding irregularly. So often in polycystic ovaries there is irregular menstruation, meaning that there may be prolonged periods and there may be a long gap between periods, and all this happens because there is no ovulation and subsequently there is no progesterone. So this is in brief the pathology of polycystic ovaries.